So the sinus tarsi, this is the lateral malleolus, and the sinus tarsi, we can see this depression, also known as GB40 in the traditional acupuncture nomenclature. That goes right into the subtalar joint. So between the talus and the calcaneus, which is the joint that essentially is sprained during an ankle sprain. So we can see what we do here. We find the sinus tarsi and we advance it. And this is pretty deep because we're going right into the joint. This here's a 75 millimeter needle, and I'm already in about halfway with it. And I always put 2 needles in that joint. Doing okay, Dan?
Yeah. Perfect. Thank you.
Perfect. And essentially, it's a 2-needle technique inside the subtalar joint. And then what we can do is we can add our stimulus. And we're on the same frequency, 20 to 23 hertz, and we won't see anything, but Dan, you'll let me know when you feel it on the left ankle.
There we go. What it was.
Good. In this next segment, it's really interesting because we use the approach of offsetting electroacupuncture frequencies to neuromodulate joints which are stabilized by opposing muscles. So for example, we could use it on the elbow joint with the pronator teres and the supinator. The most common area is the ankle, the subtalar joint, where we use it on the everters of the foot, primarily the peroneus longus, and the inverters of the foot, primarily the tibialis posterior. Let me show you what I mean. So, for example, right here, this is the motor point of the tibialis posterior. And what I've done is I've put a 2-needle technique into that motor point. Conversely, over here, this is the motor point of the peroneus longus. And I have put a 2-needle technique there. The next thing that I've done, of course, I have 2 different stimulators. This one here is preset, as you can see here, at 1.5 hertz. And this one here, which goes to the tibialis posterior side, is preset at about 2.5 hertz, or a little higher, between 2.5 and 5.5. So now let's see what happens. I'm going to start the everter, which is at approximately 1.5 hertz. Here we go. You're going to start feeling a tap, okay? And you can see the foot everting. And now what I'm going to do is at the same time, I'm going to start the other stimulator, which is set at about 3 hertz. Watch what happens. See what's happening? It's swiveling back and forth because it's going 3 hertz this way, 1.5 this way. Doing okay?
Good. Great, thank you.
This is a great way. If we can take a look at what's happening locally, not much, right? And then we see what's happening on the lateral side. We see some muscle contraction. This is also a great approach, this offsetting technique, not just for ankle injuries, but when we're helping with the neuromodulation of rehab for any type of knee surgery, early stages of knee reconstruction, rehabilitation, because you can see what's happening here. In fact, by doing this, we're moving the hip all the way up. Look at this, the proprioceptive changes that are happening in the hip itself. So also any rehabilitation for any hip surgeries, this is something that we would do. Osteoarthritic changes in the hip, this is something that we would do. So this is, of course, something that you want to keep in mind and realize that when you get it to work, it neuromodulates the ankle. It can help neuromodulate the knee and the hip along the kinetic chain.